allows us to visualize coronary arteries to a degree that we have never been able to do before. Today I will start by basically showing you several pictures of our scanner and the procedure that we perform in order to obtain these images. This is our CT scanner, and essentially the way that it's performed is we lay the patient face up, and you basically go into this donut-shaped machine, and the machine takes pretty much high-speed images of your heart, and typically the images themselves take less than 15 seconds. So essentially we take complete images of your heart and coronary arteries in a breath hold. Now what entails the procedure is several things. Number one, the procedure is we need to inject intravenous contrast in order to maximize the visualization of the coronary arteries, which are very small. So we have these special machines that inject the intravenous contrast into an upper extremity arm vein in order to visualize these arteries. Now, what entails performing the procedure? Well, first of all, we explain the procedure to the patient. We obtain informed consent. Essentially, there is very little risk to this procedure. And again, I emphasize the word non-invasive. It's essentially a non-invasive procedure. The procedure entails injecting intravenous contrast, and all you're going to be feeling during the procedure is essentially a little pinprick of the needle going in your vein where the contrast will be injected. After that, there's no pain involved. Now, there are several contraindications to the procedure. Several of them are, for example, asthma. People who have asthma might have a little bit of a problem during the procedure, because sometimes the heart rate needs to be controlled in order for us to be able to take these pictures, which essentially are less than 15 seconds. So nevertheless, we need to control the heart rate, and by doing that, we inject intravenously a medication, which is metoprolol, or beta blocker, which some of you might already know about, and essentially it just decreases your heart rate so we can take better pictures of the moving heart. So people who are on asthma sometimes might have a little bit of a shortness of breath if we give this intravenous medications, but we screen for this. People who have arrhythmias essentially might not be ideal candidates for these images, because the images are pretty much hooked up to an EKG monitor, and the computer system basically must see a regular rhythm in order to obtain adequate images. So people who have arrhythmias like atrial fibrillation and other things might not be ideal candidates. People who have advanced congestive heart failure or severe aortic stenosis might not be appropriate for this study because of their higher risk. Now, like I said before, to decrease the heart rate, to be able to take adequate images, we inject sometimes intravenously, or we just give orally the beta blocker. Now, this is where we basically control the computer, and we see the images we obtained. This is a view of the monitor, of the display of the heart, and the EKG trace that we obtain, as you can see, is very regular. Now, what we initially do is we take images without intravenous contrast, and the reason we do that is because we want to actually evaluate the calcium in the coronary arteries, which, as you can see here, as white, is going to be growing along the wall of the artery, depending on the patient's status. Typically, diabetics have a lot of calcium in their arteries. Sometimes just genetics create calcium in the arteries. Now, the question is calcium good or bad? Well, typically it's not good. I'm sorry, it's exactly not good. And the question is this calcium associated with potential severe stenosis? So in order to determine that, we inject the contrast material, and we determine if actually the calcified plaque is the one causing the stenosis or not. By stenosis, I mean narrowing of the lumen of the artery. Now, in this case, for example, we see a little bit of a plaque here, which has some calcium, and there is a little bit of narrowing of the artery,